Alright, so for today's session, we're gonna be talking about vocabulary terms that you might encounter in a session that talks about knee pain.
Tune in as Interpret Your World's co-founder, Juan Prieto, talks about the highlights of his workday as a professional medical video remote interpreter. If you are aspiring to learn something new and gain insight into what the world of medical interpretation is really like, then you've come to the right place. Follow along as Juan talks not only about his success, but the daily challenges he has to overcome to become a better interpreter each and every day. This is Unwind Sessions with Juan Prieto.
So hello, we are in session. Today is Friday, October 1st, 2021. So of course, we're gonna make this a tradition. We're gonna be singing the first of the month by Bone Thugs and Harmony. So wake up, it's the first of the month. And I can't remember what else. But yeah, that's gonna be our first of the month song if we ever get a first of the month again, right, in this sessions, which we'll probably have quite a few. So expect that Bone Thugs and Harmony first of the month little jingle, song hook, whatever you want to call it. And lately, I don't know why I've been listening to a lot of 90s, early 2000 hip hop. I've just been putting on those playlists and I have been listening to them like there's no tomorrow. Maybe because it brings back memories from my teenage years. I don't know. Maybe my brain's too tired. It's just trying to hold on to something old that it already knows, right? Who knows? Who cares? You guys don't care about that. We are here to learn about interpretation, right? So before I get into everything else, I have to tell you good morning, Alejandro, and I hope that you are doing great. I hope that you already have the eye crust out of your eyes, you wiped your boogers, and you are ready to get to work after this unwind session, of course. So I wish you the best, and today is your day, man, and everybody's day as well. All right, before we get to the highlights and how many calls I took today, remember that we are posting vocabulary practice on all of the short video platforms, that is TikTok, Kawaii, YouTube Shorts, Instagram, which we automatically post to Facebook. So you have 5 platforms. Pick the favorite one or follow us in all of them and practice your vocabulary daily with us. All right, another thing, remember that we are still accepting comments for MIP 21. Once MIP 21 reaches 100 likes, we're gonna pick 2 comments at random. We're gonna send them exclusive links to MIP 22 and we're gonna let them record their interpretations and send them over to us so we can provide them with some feedback, which is very hard to get in this industry for some reason. Another thing is, remember that we also have a Patreon page for as little as $1 of your support. You help motivate us to create much more content, and we give you access to everything on that page. I said everything. All of the medical practice video free of annoying ads, scripts, answer sheets, vocabulary lists, and much more content. One last thing before I get into what you came here to see. If you have 2 years of medical interpretation experience, live in the United States, Mexico, or Costa Rica, and are looking for employment in BRI or OPI, I am your man. Go ahead and send us an email at interpretyourworld@gmail.com. I will leave a link in the description and I'll hook you guys up with for some information so you guys can get hired in this lovely company. By the way, it's a third-party company, the company that I am employed in. So good recommendations, good company. The best company that I worked for here in Mexico. All right, and that is it for my commercial time is up. Today I took 28 sessions, 4 of which were audio sessions, and they were quite short. Today's sessions were not that long. I don't think there was any sessions over 45 minutes. Um, and yeah, everything was pretty straightforward. No bad sessions today. Everything was all right. I have one highlight today, and this is just something fun. Um, those moments that make you feel all warm inside to be an interpreter, not really related to interpretation, but more to the interpreter profession. And it is that today I received my first digital fist bump. So, what am I talking about? The So it was a little boy. He looked to be 11 or 12. That's what he looks like. He was kind of big, and but he had some sort of delay or something because he was not speaking and he was not really listening to his mother, and he was just doing his own thing. So this little boy, yeah, as soon as he was gonna leave the office, he went up to the doctor and he fist bumped the doctor, and then he went up to the iPad, but I thought he was just curious about it, and I didn't see what was going on. And then the doctor started laughing and he says, "Oh, he's trying to give you a fist bump." So of course I couldn't leave the little kid hanging, and I went ahead and I gave him his digital fist bump, and he was very happy, and so was I. I mean, I didn't see his fist bump or everything, but as soon as he saw the fist on the camera, I could see his little smile. So it was awesome. It was very good. You know, those moments that just make it feel good that you're an interpreter. All right, so I wish a lot of those moments for you. And today, let's get started with this 10 vocabulary words that you might get in a session about knee pain, right? Knee pain, one of the things that it is very, very common, one of the top reasons why people go to the doctor. All right, and this is very basic vocabulary. I think I will do another video, but more about like related to like surgeries for joints and stuff like that, like knee replacement, hip replacement, all of that stuff, and hopefully it'll be good, because I feel like there are a lot of words that, of course, right? I mean, but there's a lot of words that you guys should know. All right, let's get started. So word number one is cartilage. In Spanish is cartílago. And cartilage is a rubbery, flexible tissue which acts as a shock absorber at the joints. It coats the joint ends of the bones and cushions them because it can change shape under pressure. So if you're not familiar with what cartilage is soft tissue, like our nose, the hard stuff that you can feel on your nose, except for up here, like all this stuff right here that moves, that's cartilage. So one would imagine that is like bone, but it's not. It's more like kind of like well, it says here rubbery and flexible. I would say like plasticky and flexible, if there's flexible plastic. I don't think there is. So yeah, more like rubber, like between rubber and plastic, because it's hard but it bends. So I don't know. By the way, random fact, shark bodies do not have bone in them. They're all cartilage. So there is nothing left behind when a shark dies. He's just gone. It's not as hard as bone. All right, and yes, we have cartilage at the end of the tissues on all of our joints. So right here we have some cartilage, and that helps so it doesn't hit bone on bone, right? The bad thing about cartilage is that it wears out with age, and also one time a doctor told me, I don't know if this is true, but whenever you exercise a lot, like you start to get spikes, cartilage spikes in your knees, and then that causes a lot of pain as well. Don't take my word for it. That was a doctor that I went to see because I have horrible posture, and I went for knee pain, but it turns out my whole body is out of structure. They didn't do anything, they just treated me for knee pain. And of course, nothing got fixed because my problem comes from the feet to the knee to the hip. Even my shoulders are not right. So I'm all bad. But I'm getting better. Every day I am working to get better posture. Let's go to number 2. Number 2 is joint, and the Spanish translation is articulación. So this is a junction between two bones. The knee contains two joints, the patellofemoral, which is the meeting of the kneecap and the femur on the thigh bone, and the tibofemoral, which is the joint between the femur and the tibia. The movement of two bones via a joint is called an articulation. So this is a joint right here, and the knee is a joint. You have hip joints. I'm not sure, I'm pretty sure this is a joint, I'm sorry, but the neck joint, is it really? The shoulder joint? I don't know if it's called a joint or not. Maybe in the spine, right? I don't know. But anyways, well, that's pretty self-explanatory, right? If it moves, it's a joint. Okay? And I was looking at the definitions for, well, at the translation for joints. Why do I look at translations before actually adding it here? Because I'm not very good with Spanish writing with accents. They kill me. I don't know where they go. I've learned some of them. I know that if a word ends in C-I-O-N, the O gets an accent, but other than that, I'm very bad. I'm very bad with accents because, of course, I went to school in the U.S. in 4th grade, so all of that, and I didn't come back until here. I'm studying college, so from 4th grade to college, from 4th grade to high school graduation, it was all U.S. education. So there's a lot of blanks in my Mexican education. And this cost me some very, very good jobs. But anyways, let's get back on track to what we were talking about, right? So pretty self-explanatory. If it moves, it's a joint. I'm not sure about this. I have to get back to you on that one. But yeah, I mean, they're joints, right? That the spine has different joints. All right, number 3. Number three is ligaments and ligamentos. And this is something that I learned today. I didn't really get much into learning the definitions for ligaments, and but I learned it today. So ligament, but I definitely well, ligaments, ligamentos, that's pretty easy to translate, right? So I knew that one, and I don't think I've ever looked up that word because I knew it from, I really like to exercise, and of course now I'm not really exercising, I'm doing more physical therapy, but I have pretty good knowledge on a lot of these terms, so I already knew that one, and I never cared to look up a definition for this. I never really needed it. So ligaments, they are strips or bands of fibrous connective tissue which serve to provide strength and support in the musculoskeletal system. Ligaments are distinct from tendons because ligaments connect bone to bone. I did not know that. Tendons connect muscle to bone. I knew that. Ligaments are central to the structure and functionality of the knee. Knees contain 5 main ligaments: the anterior and posterior cruciate ligaments, the lateral and medial collateral ligaments, and the confusingly named patellar tendons are all ligaments of the knee. All right, so what are ligaments? Ligaments are what hold your articulations together. So they are like fibrous tissue that holds this thing together. If we didn't have ligaments, then this would just like it would just hang. We couldn't even move it because it wouldn't be in place. So it is the ligaments that hold or or joints in place. So I mean, imagine if it didn't have ligaments, like it just could like rotate, and then this could like move up, like this bone will stay in its place, and this bone could move like up here, you know, and stuff like that. So ligaments are very important, and you can see how important they are if somebody has knee pain, right? And for number 4, my arch nemesis, the one which I cannot seem to remember, and I have it here, and this is a different, you guys are not going to be able to see it because of the light, but this is my little cheat sheet, and I have it there, but what I have here is orthotics, but the word that is there is orthosis, and let me show you how it's written. Orthosis and orthesis in Spanish, and I cannot seem to remember that word for some reason. I don't know why. That's why it's written in my little cheat sheet there, in my little sticky note cheat sheet. So what is this? An orthosis is an external orthopedic appliance which corrects and aids alignment and functionality or musculoskeletal structures. Braces or splints are common form of orthosis. All right, so I think that is pretty much explanatory, right? Braces, for example, if you have, what's it called? I forgot the name of it. Something with your wrist. Oh man, and LEPs mispronounced that so bad. Carpal tunnel. Carpal tunnel. So carpal tunnel is a problem with the wrist, right? I'm pretty sure it's with the tendons of the wrist. I cannot remember well, but yeah, let's just say it's tendons for now. Take my word for it. So something that they do is they immobilize the wrist so that the patient does not have that much pain. So he gets a brace. Well, the patient gets a brace, right? It could either be a splint, which is fixed. It's hard, like a outer cast, and then you can't move it, and that rests the hand. Also, you can get splints for the foot, for the ankle, and well, braces, you can get braces for the knee, right? A knee brace to support your knee, to give your ligaments a little bit of a break and help you recover and rest those ligaments and tendons. All right, number 5. Number 5 is probably one of the major causes of knee pain. Osteoarthritis, and this is osteoarthritis in Spanish. So osteoarthritis can be a result of aging, obesity, or injury. It is known as a wear and tear form of arthritis and results where cartilage within weight-bearing joints breaks down, leading to pain and inflammation. Osteoarthritis can cause cartilage to stiffen and loosen its cushioning properties. This results in friction and swelling at the joints, and eventually bones can even come into contact with each other, seriously limiting joint mobility. Now, I did not know that. I did not know that osteoarthritis means the stiffening of the joints. I thought it was just the absence or the wear, but I mean, it makes sense, right? I mean, if something is soft, then whenever you apply pressure, it'll be compressed, right? And when you release the pressure, it'll be expanded. But if it tightens, then I mean, it'll be like this, and if you apply pressure, then it will only have much pressure on, like, let's say it's like this, no? And then it's hard, so you apply pressure instead of like compressing, it'll like dent, right? So I'm guessing that's one of the reasons that osteoarthritis happens. So imagine, like, it's hard. It's no longer like rubbery and malleable, it is hard. So what if you have something hard and you rub it against, it starts creating that shape, right? And it starts getting creating that groove, right? If you're rubbing, imagine the knee, like it's always doing like this, and then this is supposed to be soft and cushioning, and it's no longer soft and cushioning, it's hard. So I could imagine that pain, and also that is going to be wearing down the cartilage. So all of a sudden you're going to be hitting bone on bone. And yeah, I've seen those cases, and those people have it bad, and the only thing that they can do in that case is a knee replacement, and that's even badder. So take care of your knees. Uh, of course, we can't do anything about aging, right? But we can have a nice weight, because imagine um, if the cushion has a lot of weight, like the cushion is like this, right? But if you apply a lot of weight, it'll get squished down like a sandwich. So imagine that. That's gonna give you wear of the knees much, much quicker. And that is one of the things that they tell overweight patients. That is the first thing that they tell them. One of the things that is going to help you the most is losing weight. So let's take care of our knees, guys, and let's be able to walk for a very long time. Number 6. Number 6 is patella, and in Spanish is rotula. So the medical name for the kneecap. The patella is technically called a sesamoid bone. I don't know what that means, which is a bone situated within the tendons of a muscle. Okay, I know what. The patella is actually part of the tendons of the quadricep muscle group, because the quadricep muscles contain the patella. Any alteration within the quads affected. I didn't know that. A strong quadricep complex is essential for optimum patellar function. The patella sits within a V-shaped groove, a trochlea in the femur, and is free to move up and down, but not side to side. So the patella is, if you straighten your knee, you are going to be able to feel like a disc-shaped thing. And how is it? Is it when we're standing that we can move it? I don't know, but that disc-shaped thing is the patella, and that little bone, like behind the bone, there could be irritation there from injury or arthritis and all of that stuff. So that is going to be one of the main things, or a word that is definitely going to be mentioned whenever there is knee pain, because the doctor might even try to move it to make sure that it has good good mobility and it's stable. Because I had a case where I don't remember well, but I think the patella was ruptured on the back, like or somewhere. It had a rupture on it, and I can't remember what they diagnosed the patient with, but it had a rupture on it, and he was having a bad time. And I think they gave him an injection or something. So the patella are practically it protects the knee joint, but it can also get injured and damaged, of course. Tendons. Number 7 is tendons, and this is tendones. So tendons are these fibrous or fibrous. How do you say them? Fibrous. They both sound good to me. Can anyone care to explain or drop it? Let me know. I'll just look it up. Let's say fibrous, fibrous ends of muscles which connect your muscles to your bones. So if you're not familiar with what tendons are, I mean, the definition is pretty much self-explanatory, right? But the tendons are what allow the muscles to move the bones, right? Because the bones by themselves, they are not moving, they are just still. But how do you get them to move, right? So nature's answer was to attach them to something. So I don't know exactly where we have uh, I don't know exactly where we have the tendons. Well, maybe on our hand. I think these are tendons right here, right? These are tendons. So they're like the little strings on our meat puppet body, on our meat puppet body, on our meat puppet body. I don't think I've never used that. That's why it wasn't coming out right. So yeah, these are definitely tendons, and they attach. I'm not sure if these are tendons. Maybe the tendons are up here. But anyways, the point is that and there's a lot of tendons here, right? That attach this, and there are ligaments here as well. So the tendons are what allow this. So they are attached to the bone, and they like pull the bone, right? So we can move, right? Like do like that, right? So without the tendons, how would the muscles be attached to the bones? So tendons are very, very important. And tendons are like one of those things that get very irritated, which gives you tendonitis, and that is very common with an injury or with knee pain, more with knee pain. And I didn't include that because I want to do another video, but more generalized about just joint pain in general and arthritis and all that good stuff. So that's why I didn't include it here. But yeah, tendons are major cause of knee pain as well. Number 8. Number 8 is meniscus, and in Spanish is menisco. So a meniscus, each of your knees has two C-shaped pieces of cartilage that act like cushion between your shin bone and your thigh bone, menisci. A torn meniscus causes pain, swelling, and stiffness. You also might feel a block to knee motion and have trouble extending your knee fully. Okay, maybe that's one of the reasons why they say, can you extend your knee fully when they have problems with their knees? Because one of the things that the doctors really mention a lot is meniscus. They say as soon as you mention knee pain, they are going to see, or they are going to try to diagnose or rule out a meniscus tear, because that is one of the most common reasons of injury in the knee, as well as all the other ones that were mentioned. Of course, the doctor will always go for the easy things, right? Like tendons or ligaments, and then he'll look meniscus, and then he will look at the following one. The following one is the anterior cruciate ligament. This is ligamento cruzado anterior. This is the ACL, and this in Spanish is LCA. I'm sorry, ACL and LCA. ACL, LCA. All right, so this is one of the key ligaments that helps stabilize your knee joint. The ACL connects your thigh bone femur to your shin bone tibia. It's most commonly torn during sports that involve sudden stops and changes in direction, such as basketball, soccer, tennis, and volleyball. So yes, this is one of those ligaments that likes to get torn. I don't know why, but definitely if someone is coming in with knee pain, that is one of the ligaments that gets looked at to get ruled out, because as well as the meniscus is one of those things that are most commonly causes for pain in the knee or get injured during anything that could happen with the knee, injury, old age, all that stuff. Well, not really old age, right? Well, yeah, I mean, maybe old age, right? Your muscles are not as strong, your ligaments are not as strong, so your knee gets unstabilized, and then you have problems there. That could happen as well. And for number 10 and the end of this list, this is corticosteroids. This is corticosteroides. Let's look at how it's written. That was news to me. I always thought it was corticosteroides because that's how you say it, but no, it's corticosteroides. Corticosteroides, not corticosteroides. So I learned something else today, and it's always nice. I love learning new stuff. So corticosteroids are medications that doctors prescribe to treat some illnesses or injuries. For example, corticosteroids can be used to reduce or prevent or swelling and irritation like asthma, control medications, or anti-itch creams. Not to be confused with anabolic steroids, which anabolic steroids are what muscle builders use. You know, they inject that testosterone. Good old, can't even wipe their butt. But to each his own, right? But yeah, so corticosteroids are, for example, I've had corticosteroids injected because of knee pain. Like I mentioned, I had very, very bad posture, and whenever I started to exercise, I would be good for about 2, 3 months, 4 months, 5 months, 6 months, maybe if I was lucky. And then all of a sudden, I would get injury in the knee or injury in the shoulder because of my bad posture. My shoulders, they look okay now, and my posture looks okay now. But like I used to be like this. Like you don't even know, like probably like that. Like you can't really see it because of the black shirt, but that's horrible posture right there. But like, oops, I dropped that mic thing. But let me see. There we go. Come on. See, you see how my head is like a little bit straight, and then my shoulders are pulled back. So that's good posture. Now this is not good posture. And my posture was bad all the way from the feet, like I already told you. I'm really working on that now. But yeah, I've had corticosteroids on both knees. I'm not sure if I've had them on the shoulders though. But I've had physical therapy for shoulders and knees, and I know why people say physical therapy doesn't work, because all of the physical therapists that I've been to, all of them, they just like focus on what you tell them. If you tell them my knee's hurting, so I don't know if I've been to bad physical therapists or what's going on there. Maybe they're just lazy, they don't want to do your job, I don't know. But it was me who had to discover all of that stuff. And I went to physical therapy for knee pain, and I was there for how many weeks? Like 4 weeks, I think. And of course, nothing got fixed because my problem actually comes from my thigh, right? No, not from my thigh, from my hip. So I feel like I'm just blabbering on too much. So let me just get to the point here. So my all of my joints were bad. My joints are still bad. My hip needs to be pulled back. My thighs need to be pulled out. My knees need to be a little bit pulled out. My feet, they are pronated in. They need to be like this. My spine is how is this? It's like the Instagram spine, you know, how they do it like this, and then like the booty sticks out. That's not supposed to be like this. It's supposed to be like much more straighter. And then my shoulders, of course, and then right here I have like a little hump that I'm trying to get rid of as well. So I have suffered through all of this in corticosteroids, and I'm still suffering through it. So there you go, my little sob story of about how I have very horrible posture, and I am working to correct it every day. And one of the things that helped me to correct it was being a VRI, because I see myself on the little screen on camera every day, and that, of course, I see myself like this all of a sudden, and then I'm like, damn, I gotta straighten back up. So I straighten back up, and all of a sudden I'm like this, and then I'm working at it, and yeah. So that's it. That's my story about having bad posture. I'm pretty sure a lot of us can relate. So take care of your posture, guys, because nobody wants to have pain, right? And another thing, one last thing before I go, is that For example, me, I had a bad posture. I'm 33 years old. I don't know how old I was. Maybe I remember when I was like 12, 13 years old, people started to tell me to stop slouching and stuff, and I didn't care. I was like, I don't care. And now I do care a lot. So take care of yourself, guys, because if you have a problem with bad posture for 25 years, it's not gonna get better in 1 year or two, probably three, but it's hard. So it's better to prevent it in your children, prevent it in your family, and let's get good bone health and good posture for all. All right, that's gonna be it for me today, guys. Please leave your questions in the comments and I will answer some of them on the next session. If anything is time sensitive, please let me know and I will get to that before the end of the queue. One last thing about good posture. We as interpreters are, well, a lot of people right nowadays, we're working from home, we're working at offices all day, so posture should be your top priority, and you should make it your top priority to get good posture and to figure out how to get your good posture, because your body is going to pay dividends in the long run if you do, and if you don't, it'll charge you a big fine. All right. Okay, remember that I'll be here every Monday through Friday after work, rain, sleet, hail, or snow. I want to send a lot of love to all of our Patreons. We love you guys, and to everyone that has bought us a coffee as well, all of our subscribers, and all of our viewers, and everyone that is watching the end of this video. So I love you guys, and I'm sure everybody in the team does too. We all love you guys. So thank you so much for watching. Please like and subscribe if you liked the video and have not done so for much content. And don't forget to share. Happy interpreting. Goodbye.
Thanks for listening to this episode of Unwind Sessions. Make sure to subscribe on Apple Podcasts, Spotify, or wherever you listen to your favorite shows. And if you learned something new today, it'd be great if you left us a review. You can also visit us on patreon.com/interpretyourworld or visit our website, interpretyourworld.com. Unwind Sessions.
If you like this video, don't forget to smash that like button. Also, share this video with other beginner interpreters or anyone who can benefit from this information. Thank you all so much for all the support you guys have given us. This means the world to us. Don't forget, we also have social media. We have a Facebook group and a Facebook page. We also have an Instagram and the one I love the most, TikTok. We just recently got a Buy Me a Coffee, and also, if you guys didn't already know, we do have a Patreon account. If you guys would like to support us a little more, we'd love to have you guys over there. And as always, I will be posting all the links to these pages down below in the description box. Thanks for watching!